Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about follow-up of postnatal mothers. So go ahead, subscribe, and let's get started. First, let us see the definition of the term. Follow-up of postnatal mothers means the continuous care and regular assessment of a mother after delivery. This care is provided to make sure that the mother is recovering well, physically, mentally, and socially. It includes monitoring her health and supporting her needs during the postnatal period, which usually lasts up to 6 weeks after childbirth. Now let's talk about the objectives of postnatal follow-up. The main aim is to make sure that the mother recovers well after delivery and regains her strength and health. Another important objective is to identify any complications early, like infection or excessive bleeding, so that we can manage them before they become serious. We also focus on supporting the mother in breastfeeding and helping her learn how to take proper care of her newborn. This is a very important part of postnatal care. Along with that, we provide guidance about family planning so that the mother can space her pregnancies safely. We should also pay attention to the mother's psychological condition, because many mothers may feel emotional or stressed after delivery, and they need support. Finally, we ensure that the mother maintains proper nutrition and hygiene, which are essential for her recovery and overall well-being. Now let's look at the schedule of postnatal visits. According to the recommendations of the World Health Organization, follow-up care should be done at specific intervals to ensure both mother and baby are safe and healthy. The first visit should be within 24 hours after delivery, because this is the most critical period where complications can occur. The next visit is on the third day, that is between 48 to 72 hours, to reassess the mother's condition and check if everything is progressing normally. Then another follow-up is done between day 7 to 14, where we monitor recovery, breastfeeding, and any delayed problems. Finally, a checkup is done at around 6 weeks after delivery, which marks the end of the postnatal period, to ensure complete recovery and to provide further advice like family planning. Now let's go through the assessments we do during a follow-up visit. First, we check the general condition and vital signs of the mother. This includes temperature, pulse, respiration, and blood pressure. It helps us understand whether the mother is stable or if there are any signs of infection, weakness, or other problems. Next, we assess the uterus. After delivery, the uterus should gradually shrink back to its normal size, which we call involution. We also check whether it is firm or not. A soft uterus may indicate a risk of bleeding, so this is very important. Then, we look at the lochia, which is the vaginal discharge after delivery. We check the amount and the odor. Normally, it should gradually reduce and should not have a foul smell. If there is excessive bleeding or bad odor, it may indicate infection. We also examine the breasts. We check for engorgement, pain, or any difficulty in feeding. At the same time, we observe whether the mother is able to breastfeed properly and guide her if needed. After that, we assess the perineum, especially if there was an episiotomy or tear. We look for proper wound healing and check for redness, swelling, or discharge that may indicate infection. We also check the bladder and bowel function. Some mothers may have difficulty passing urine or may experience constipation, so we make sure these functions are normal and advise accordingly. Finally, we assess the mental health of the mother. This is very important because some mothers may feel sad, anxious, or overwhelmed after delivery. We look for signs of conditions like postpartum depression and provide support or refer if needed. Now, let's discuss the danger signs that we should always educate the mother about before discharge. First is heavy bleeding. If the mother is soaking pads frequently or passing large clots, it can be a sign of postpartum hemorrhage, which is an emergency and needs immediate medical attention. Next is fever. A high temperature may indicate infection in the uterus, urinary tract, or any wound site, so it should never be ignored. Foul-smelling discharge is another important warning sign. Normally, lochia should not have a bad smell, so if there is a foul odor, it may suggest infection. Severe abdominal or pelvic pain is also a concern. Mild pain is expected after delivery, but severe or increasing pain can indicate complications like infection or retained products. Breast infection is another danger sign. The mother may complain of breast pain, redness, swelling, or fever, which may indicate mastitis and requires treatment. Finally, we should watch for depression symptoms. If the mother feels persistently sad, withdrawn, anxious, or has difficulty bonding with the baby, it may indicate postpartum depression, and she should be supported and referred for care. Now, let's talk about the advice we should give to postnatal mothers. First is maintaining good nutrition and hygiene. The mother should take a balanced diet that is rich in proteins, iron, and fluids to help her body recover and to support breastfeeding. At the same time, she should maintain personal hygiene to prevent infections. Next is adequate rest. After delivery, the mother's body needs time to heal, so she should get enough sleep and avoid heavy work. Family support is very important during this time. We also strongly encourage exclusive breastfeeding. The mother should feed the baby only breast milk for the first 6 months, as it provides complete nutrition and immunity to the baby, and also helps in bonding. Finally, we give advice on family planning. The mother should be guided about spacing methods so that she can plan her next pregnancy safely and maintain her health. Now, let's understand the role of the nurse in postnatal follow-up. The first role is to monitor the mother. This means regularly checking her condition, including vital signs, uterine recovery, and overall well-being, to make sure everything is normal. Next, the nurse provides education. This includes teaching the mother about breastfeeding, hygiene, nutrition, newborn care, and also informing her about danger signs that should not be ignored. Another important role is early detection of complications. The nurse should be able to identify any abnormal signs like infection, excessive bleeding, or emotional problems at an early stage. Finally, if any serious problem is identified, the nurse should refer the mother to a higher center or specialist for further management. That brings us to the end of this video. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content.